All right, folks, we are live. Welcome back to the next episode. This is actually episode 6 of iDryNeedle to the Point. Honestly, I've been looking forward to this episode, this guest, since we launched this podcast. I reached out to Jeff. He's one of the first guests that I reached out to, and I'm very excited he has some time to talk to us today. Before we get into it and before I introduce him, if you didn't get the memo last week, if you're not catching us live, we are now on iTunes, Spotify, Google Podcasts, pretty much wherever you watch your recorded stuff. We're trying to bolster our YouTube channel, so you can catch us on any of those platforms. Plus, of course, you can follow the link in our profile to our Podia educational platform. I'm your host, Paul Kaloran, president of iDryNeedle, but I am very excited to introduce our host today. You've certainly heard of him. I'm sure you recognize him. It is Jeff Moore. He's a PT, DPT.
Hey, there we go. Got you back.
There he is.
All right.
Man, that's the detriment of being live. Did you catch? I gave you the full intro. Did you get all that?
I'll hear it later. I'm sure it was great, and I very much appreciate it. And I really do appreciate you bringing me on here. I love what you're doing with this show. I love the idea of shorter, kind of impactful segments that we can really get into it and have everybody walk away with some clinical value. So thrilled to be a part of this, Paul. Thank you so much.
Of course. Thank you for your time. If you haven't tuned in, the whole idea of To the Point, I will give kind of that little dry needling infusion, but we're going to try and condense, like Jeff said, this clinical discussion to 15 minutes or so. We'll keep it succinct and we'll keep it on target. Cool. So really today, the theme of today is PT has changed. And that's kind of a big statement. Most new grads or even recent grads are kind of nodding their heads because they've realized some of the paradigm shifts, but we're going to dive into kind of how it's changed and where we're going. And really to set the stage, I'll give my little dry needling infusion, and I'll just explain that for me personally, dry needling was kind of this paradigm shift for how I treated in the clinic. And that's not even to say interventionally relying more on this new modality, this new tool, but really even the concepts of central nervous system processing and pain and function. Everything really changed for me personally when I started needling. But even beyond that, I do think if you take the intervention, the modality aside, that it does show some progression, some maturation of, without trying to offend anybody, a fairly benign profession in the past, really do no harm, do no good kind of a thing. Now we're adopting an invasive procedure that has higher risk, but really that's a sign of a maturing profession that we're able to mitigate those risks as a doctoring autonomous profession. So really that's just me giving that tiny little dry needling infusion and telling my story, but really not needing to stay on the dry needling topic at all. I want Jeff first to start with kind of that 30,000 foot view, and I'll let you explain kind of how do you think PT has changed?
Paul, I think you're onto a lot of it with that maturation, and I think one of the things I would say I've seen in the past 10, 15 years the most is just a move towards autonomy, which comes with that kind of maturation and the ability to take on some of those interventions that maybe were a bit outside of the box for us historically. And now we're getting more and more comfortable with that kind of stuff. I don't see us being underneath anybody's thumb nowadays. I see most, and there's a combination of reasons there. There have been really advantageous legal proceedings, in the past decade that have gotten us better access to folks, overall better abilities to express what we do with a larger population. And I think, honestly, physios have gotten better at owning our space, both from the research side and clinical side of, we really do think that we should be the first stop shop for all things musculoskeletal. I mean, we've got good research showing that, when you engage with a physio early on, when you have that onset of back pain, things seem to go in the right direction, from a pharmacology standpoint, from an overall course of care, downstream use of medical procedures. It seems like it is the right place to enter the system for those MSK issues. And so I've seen a lot more autonomy in the past 10 or 15 years. That's certainly one big thing I would say, Paul. And the other big one is I think we've finally shifted away from a lot of what have to be admitted were unproven biomechanical models. Find the passive fault, fix the passive fault, person feels better. We got really wrapped up in that, and it was well intentioned, Paul. I mean, it was a reasonable, logical thought process, and unfortunately, we got stuck down that rabbit hole pretty far. And I think we've zoomed out now a lot and focused more on general strength and conditioning. Lifestyle behavior, someone's total human health ecosystem, their beliefs and expectations. I mean, the things that really seem to lead somebody to a healthier place. I think we've shifted more in that direction. So the combination of increased autonomy and more of that zooming out in that whole human health ecosystem focus, I think have been some really big shifts in the past decade.
Yeah, I totally agree. And you've already touched on kind of or I'll just say you are kind of tip of the spear with the continuing ed for currently practicing professionals with ICE Physio, everything you're doing from manual techniques to, like you said, the strength side of it. And you're also kind of tip of the spear on the education side with South College. So kind of a conceptual or theoretical question for you. Do you think these changes that we're experiencing in PT, are they changes in the education model that are driving changes in practice? Or do you think these changes in practice are trickling down and changing how we educate or changing the educational side of PT?
That's a great question. And it's tricky because some of it I don't think is necessarily intimately related, yet it's synergistic. So what I mean by that, from one huge shift, I think that is happening is the focus on both arresting and hopefully reversing the student debt load that graduates are currently under, right? Because it totally stifles good decision-making, professionally, personally. It truly, Paul, I'll never forget when John Childs years ago first started talking. I still work with EIM and have a wonderful relationship with that group and their fellowship, and work in several of their programs, and have such a pleasure doing that. And so I've known John for years. And I remember when he was first saying this, and I was like, dude, this is it. Like, of everything I'm hearing at conferences, so many folks saying, well, Jeff, that's great. Love that idea of practicing that way. Totally unreasonable for where I am debt wise and position wise and professional wise. And it was like, man, if we don't change this, everything else is for naught. So I think that while clinic and education might not have maybe teamed up on that decision, I think the efforts from the educational model to leverage technology and get this done more efficiently in a shorter period of time with decreased costs, because people don't need to live on campus all the time every day for years in a row, and we can get it done in 2 years. So on year 3, our graduates are already out practicing, whereas most schools are still having another year of tuition. That change was paramount to us as a profession as a whole having success. So I think that while those might not have fed off one another, clinic and education, that needed to happen and continues to happen at a very fast growing rate, which gives me a lot of optimism. As far as the actual question of which one's driving, I think that aside, I think clinic is driving education more than education is driving clinic. So I look at what I see out there anyhow, and you're seeing so much research coming out supporting strength and conditioning principles, right? Making the human more resilient and robust. Maybe not worrying quite so much about small biomechanical minutia and worrying more about how healthy is that organism? How hard are they to hurt no matter what they do? And kind of that focus on things, that shift in that direction, as well as people getting really enamored with things like CrossFit and Olympic lifting and gymnastics, and being in these new spaces where we need to learn how to do this. And Paul, I say this as respectfully as I can. We are not the movement experts. We aren't. We can be. We can get in that direction. But if you've spent any time among high-level CrossFit athletes and coaches, gymnastic coaches, we are not there yet. But what's cool is we're charging in that direction. So we're seeing clinics say, look, people want to know this stuff. I want to be able to build stronger humans, but to be fully transparent, that was not in my curriculum. I really don't feel good about programming and breaking down multi-joint functional weight-bearing movements. Like, it's not in my skill set yet, but it needs to be. So I think we're seeing clinic drive from that perspective. And the other big one is I think clinicians are screaming for a better way to treat chronic pain, because they're seeing these patients coming in who have non-mechanical, centrally dominant presentations, and they're a totally different animal. I don't mean bad, I just mean very different, right? We can't treat them with traditional mechanical evaluations or interventions, because their issue is one of processing. And so to be able to shift how we train our clinicians, I think that our clinical demands are pushing our educational models to incorporate that pain science education, and then going beyond the pain science and actually having cognitive behavioral therapy interventions. All of those things, man, the functional lifting, the actual movement proficiency, the chronic pain, that's a cry from clinic to academia to get people better at this so that when they get out, they can really answer that call.
Man, I think there's a lot of good points in there. And even speaking personally, I agree with what you said, that I didn't graduate with that strength, I guess, experience from my DPT. So I pursued the CSCS. And this topic even came up with our discussion with Sue Falsone. They're almost, unfortunately, seems like there's almost a pride aspect in the PT realm where there's some communication barriers between us and the high level fitness professionals. Because I agree, there are some very good fitness professionals out there as far as strength and conditioning. And we yearn for this like open symbiotic relationship with primary care physicians. But then some of us don't turn around and have that symbiotic mindset with some of the other fitness professionals and even trainers in our realm. So I totally agree with that. And even just a plug for something we were discussing before we got started here, but the play offense is something I love, especially it's so poignant right now with our COVID landscape, but that kind of puts a lot of what you said into a mantra, I guess.
Yeah. I mean, Paul, it drives me crazy, man. So, I mean, I teach pretty much every weekend. I teach more than 40 weekends a year. So I'm in a different clinic around the country every Saturday and Sunday with 20 or 30 new clinicians, not that they're new to the practice, but new to me oftentimes. And it's an area that, like you said, there's so much odd pushback. And I have a hard time understanding that. I think you graduate with a doctorate, you want to believe you're an expert in all these spaces, but we have to realize where we got maybe some good base education, certainly a lot of really good anatomical, physiological knowledge. But I think most of us would agree, are we experts in the strength and conditioning space? Do we have true, movement virtuosity? I think most of us would be willing to say, Lord knows when I got out the first few years, that would be a tremendous overreach to make that statement. It's still an overreach. But I've spent 5 years trying to get to a point where I am comfortable in that space and I can do some programming and look at these lifts and help folks be more efficient and have a bigger movement library, right? Not just one perfect way to do it, but a lot of different ways under a lot of loads for a lot of reasons. So like that skill set, Paul, we can get it, man, but we got to be willing to admit we don't have it before we can obtain it. And that's often a challenge,
Yeah. Or it's just an earned expertise. It's not just a provided or it's not even an entry level like assumption at this point.
Yep. Absolutely.
And one thing you touched on, I think probably is the truth just in our current landscape, is kind of the student loan burden of the traditional DPT model. So just right now, if we're saying 2020, it's a snapshot in time. What are your thoughts on kind of the current state of PT? And that's kind of appreciating what you mentioned, the student loan burden and also decreasing reimbursement rates. So not to turn this into a dark discussion, but what is the current state of PT and what are kind of the potential threats you see for some of the trajectory of where we're headed?
Yeah, it's a great question. It's not a dark question. It's a reasonable question. I do think the student loan burden is the big one. I do think that is what causes paralysis and stifles passions and really limits people from being able to express the best version of themselves personally and professionally. There's no question. I think that's the one. And I think we're making some massive headway. I mean, I can only speak from South College, but we have other programs that are leveraging that same model, looking at like Baylor and a lot of those sister programs who are doing very similar things, getting really good traction. So I think, Paul, if we can start getting folks out in 2 years, if we can reorganize these curriculums and leverage technology where we can get it done in 2 years and people can be working that third year instead of being in school and having done a terminal 6-month internship, it opens up all sorts of opportunities. So it's an issue, but I do feel we are taking huge strides to address it. When it comes to threats, man, the only honest threat that I see is ourselves. That we will fail to realize what we have to offer and be willing to sell it to the public, right? Like, dude, if this is not the era where non-invasive, non-pharmacologic therapy wins, we've only got the mirror to blame. Like, I'm not trying to bash other professions. I am saying it's been a tough couple years for opioid medication, imaging, and surgery. Like they've had a tough couple years in the research. Like if those were kind of your big levers, I would be uncomfortable, because they're very expensive. They have a lot of side effects. And what we're seeing is the overall comparable efficacy really is not superior. So if physios are willing to realize this is it, it's all coming down the pipe to show that this kind of non-invasive, non-pharmacologic intervention for all these different musculoskeletal complaints, low back pain, of which is the greatest disability worldwide, the answer seems to be loading, focusing on the ecosystem, and that we have all of it, Paul. Like that's every weekend. I'm trying to rile physios up and saying, team, do you realize what you offer? Do you realize that people can come to you and get targeted soft tissue intervention, whether it's needling, whether it's instrumented soft tissue, they can get joint manipulation and mobilization. They can get programming. You can break down their Olympic lifts, right? You can look at all of their lifestyle behaviors and measure their sleep with the PSQI and go through all of their different aspects, talk about their nutrition and get them on a performance and low pain diet. Like do you realize you are 9 providers in one? And then also, if you look at the research, is trumping all the other more costly, more invasive interventions that have a lot of side effects. If the time is not now, tell me when it is. But the question is, will we say that? Will we say that to the public? Will we put it on social media? Will we get good at selling? Are we going to get comfortable owning how good we are? That's the only threat we have.
I hope that got some people up out of their seats with an amen, because man, I get goosebumps when I feel that passion, because I just am nodding my head physically, but man, that just like pulls my heart. I mean, I think that is speaking to the truth to why so many of us entered this profession. And then somewhere along the way, we just kind of get stuck in this, the tide pool of just like where we're at right now and kind of being harnessed by certain thoughts, but also by reimbursement. So man, That's exactly why I wanted you on the show. That's awesome.
Well, I mean, Paul, we got so frustrated, man, in about the middle years of ICE, where we were graduating all these clinicians and they were going back to clinics, and we get emails that would say, dude, this was great. I now feel like a whole different kind of weapon, but my clinic doesn't practice this way. And that's where Onward Physical Therapy came from, right? We said, well, we'll just create homes for these people so that we can actually start doing this stuff and having this kind of branding and telling the public that if you're going to come in and get all of those things in 1 hour, it's worth $150 a session or more, and helping to get their heads around, boy, if I can have one provider, not 4, it probably is worth a significant financial investment. So that's kind of been the latest goal, that we're trying to normalize that conversation and get people to understand what exactly we have to offer.
Yeah, definitely. And even I know a handful of the Onward team. I'm looking forward to spending some time with you guys, the ICE Physio staff, later in December.
Yep.
And I can even speak recently to an N of 2 from the South College recent grads who took our level 1 dry needling course in Kansas City last weekend. I mean, not only is the skill there with the knowledge of anatomy, the functional prowess, and even the palpation, like the physical skills, but man, these are on fire students, both of them talking about the residencies they're looking into, one of them sports, one of them more pain focused, but man, it's a model, and it's almost like a look in the eye that tells you that it's working, it's positive.
Yeah, for sure. It's been a riot down there, man. I can't tell you, we got double cohorts now, right? So we have a January and a June cohort every year. So at any given time, we have 4 cohorts running. And I mean, just the quality of the faculty and the students is at a level. Every time I go down there, it's surreal. I remember looking around that first year. I'm like, Tim Flynn's teaching manipulation. Louis Puentedura's over here. I'm looking at Tim. I'm like, what is happening around here? And it's something's different in the water for sure.
Not to mention Justin Dunaway, who's with your team ICE Physio, and he gives that. He has the manual hands of Yoda, but also puts the pain science into a box that you can use with your patients.
100%.
And also, I'm a Regis grad. I'm a Tim Flynn, Tim Notaboom guy all the way. So awesome. I agree. That's a power team down there. Yep. So this is the unfortunate part of To The Point. We're already at our time. So really, Jeff, if we can go a minute or two over, just give us a soundbite. What is one thing, one piece of advice you'd give? Let's picture one person, someone considering getting into PT, and then another piece of advice for that newly graduated DPT that's just entering the profession?
Ooh, yeah, good. Those are two different, very different pieces of advice. So the first one, thinking about getting into PT, my comment is, do you live and breathe health? Like, is decreasing human vulnerability something that really fuels your tank? And if it is, would you be preaching this stuff whether you went to PT school or not because you love it? Like, if that's you, this is your jam. Like, if you would be doing it anyways, get in this profession. If you really don't feel that, I would really ask you to do some introspection before taking that big leap forward. My comment for those who have already graduated is you need to be the whole package, but you don't need to be it today. Right. So give yourself grace on where you are, but also understand that the gaps in your skill set should never drive your patient's plan of care. You being afraid of needling or manipulation or loading or pain science should never be the reason your patient doesn't get those interventions. So make sure you give yourself grace, but then you also make a plan and you annihilate that thing. So 24 months from now, you have no gaps left that drive your patient's interventions or overall plan of care.
I love it, man. That is the best way to wrap up. And man, it went way too fast. But first of all, I want to thank you so much again for your time. You can follow Jeff at Jeff Moore DPT on all the socials, Instagram, at Ice Physio. And you'll see all the other stuff he's involved with if you follow him on his bio. Otherwise, again, if you didn't catch this live, we will post it by the end of today on all of those podcast channels we mentioned. We're continuing next week, next Wednesday. We have some powerful female PT influences coming the next 2 weeks. Next week, we have Nicole Woodard, who runs at Mobility Athletes. And really, we could talk very specific, even very similar CrossFit programming, or she even has cash pay PT, and she does coaching for both athletes, but also other clinicians. Week after that, we have Lauren Ginsberg, who is at Sports Physical Therapy on Instagram, but she recently joined Barbell Rehab. So she's a lead instructor. So you get the idea. We're looking at a fitness focus here, that the barbell plays into rehab. And I think Jeff kicking us off on that thought was perfect. So thanks again, man. I hope you're back on here at some point. I hope to see you face to face soon. It'll be in December, but even beyond that.
Yeah, man, absolutely. Thank you so much for having me. And thanks for all the work you're doing. These are really important conversations. So thanks so much for spending the time to up the profession.
Awesome. Thank you. All right, guys, we'll see you next week.